Good day. I'm Emmy Nokaneng. I'm a maxillofacial and oral surgeon based in South Africa. I'm also the secretary of the International Skin Care Advisory Panel. I'm delighted to be here today to be able to give you an overview or speak to you about the Made Easy on the best practice recommendation for the prevention and management of skin tears and aged skin. The Made Easy provides an overview of the updated 2025 ISTAP best practice recommendation for the prevention, assessment, classification, and treatment of skin tears and aged skin. In essence, it's a quick reference guide. It also supports ISTAP's mission to have a world without skin tears and also to raise global awareness of skin tear prediction, assessment, prevention, and the management thereof. This was a collaborative effort between the International Skin Tear Advisory Panel, the Ostomy and Continence Nurses Society, as well as nurses specialized in wound, ostomy, and continence Canada. The Made Easy provides updated definition of skin tears, where a skin tear is a traumatic wound caused by mechanical forces, including the removal of adhesives, patient handling, and the depth of which vary, not extending through the subcutaneous tissues. With regards to the current definition, it emphasizes the significance of the etiology as well as the anatomical limitation of the wound, that is the skin tear. With regards to the etiology, it emphasizes the importance of iatrogenic causes such as mechanical forces, which includes patient handling and medical adhesives. With regards to the anatomical extent of the skin tear, it involves the three different layers of the skin, but it does not emphasize the thickness of the skin. Therefore, it only extends right up to the level of the subcutaneous layer. This definition is important as it delineates skin tears from other traumatic wounds such as lacerations. In addition, we have defined a flap in relation to skin tears. According to Van Tegelen in 2020, a flap is a portion of skin, whether it includes the epidermis or the dermis, that is unintentionally separated, whether it be partially or fully, from its original place due to shear, friction, blunt trauma. This is not to be confused with a tissue that is intentionally detached from its place of origin for therapeutic reasons, for example, a skin graft. We also define skin tears in terms of the healing period into complicated and uncomplicated wounds. An uncomplicated skin tear is expected to achieve full epithelialization or heal within approximately 4 weeks, whereas a complicated skin tear does not heal within 4 weeks. The identification of individuals at risk as well as risk factors is integral to the prevention of skin tears. We all know that the etiology or the risk factors for skin tears are multifactorial. But interestingly enough, in 2023, Chalifa and colleagues found that daily living activities such as washing with cold water and soap, lack of moisturization of the dry skin, and the wearing of short sleeve that exposes the skin to mechanical forces predisposes the individuals who are at risk to skin tears. Furthermore, they found that the use of adhesive bandages, the wearing of jewelry by clinicians, or the presence of long nails, whether being the clinicians or caregivers, as well as lack of gentle handling, also predisposes individuals to skin tears. The Made Easy also provides a quick reference guide to the ISTAP risk reduction program, which encompasses looking at the general health, the mobility, as well as the skin integrity of the individual. Recently, the concept of bundle approach has been applied to the management and prevention of skin tears. Khalifa in 2022 defined bundle approach as a small, straightforward set of evidence-based practices or intervention, usually 3 to 5, that when performed collectively and consistently have been proven to improve patient outcomes. With regards to skin care recommendations and for fragile and aged skin, the prevention should include maintaining skin integrity through daily skin care. For example, the washing of the skin should entail utilizing pH balanced soaps, the use of emollient-based products, and avoid those that have alcohol, as well as the avoidance of use of hot water. With regards to moisturization, it is recommended that the skin be moisturized twice daily with the application of skin-friendly moisturizers and those that are pH balanced. And lastly, to encourage individuals at risk to have a daily skincare regime, education on skincare practices rather. The assessment of individuals at risk for skin tear or the one who has acquired a skin tear should entail a holistic or general assessment of the patient. And for this, the ISTAP data collection tool is recommended. This can be downloaded from the ISTAP website, or you can scan the QR code at the end of the presentation. Assessment of the baseline skin tone is also critical. And for this, a validated skin tone tool can be used where the patient's normal skin tone is assessed to reduce potential biases and to improve assessment accuracy. The tool displays a range of skin colors that can match with the patient's skin tone, with a baseline determined as the tone that matches the inside upper arm of the patient. It should be noted that erythema does not always appear as redness in many skin tones, especially those individuals with dark skin tones. For consistency in the identification and documentation of skin tears, ISTAP recommends a validated classification system, where in a type 1 skin tear, it is a linear tear where the flap can be opposed to cover the whole of the wound bed, as in this example. In type 2, there's partial loss of the flap where a position of the whole wound bed is not possible. Whereas in type 3, there's complete loss of the flap. In individuals who have acquired multiple skin tears, it is recommended that each skin tear be classified accordingly, because that will influence the management thereof. The goals of treatment in the management of skin tear is to treat the cause, implement prevention protocols such as avoiding trauma, and provide moist wound healing as well as protect peri-wound skin while managing wound exudate to prevent infection as well as managing pain. The Made Easy provides a pathway to follow in the management of skin tears. In the initial step, there should be control of the bleeding, which is followed by the cleansing of the wound. When then the wound edges are approximated, thereafter one should be able to classify according to the ISTAP classification system. The choice of the dressing should be appropriate for the needs of the wound at each healing phase, but also promote undisturbed wound healing. According to Brindle and Farmer in 2019, undisturbed wound healing should entail decreasing the wound dressings to every 5 to 7 days. But this also should take into consideration the wound needs and the patient assessment. Undisturbed wound healing also reduces the risk of contamination and potential infection of the wound. Similarly, one should take into cognizance that undisturbed wound healing may not be appropriate for each and every wound that we encounter. So this principle should be applied with discretion to each and every individual. The Made Easy does not provide an extensive list of appropriate dressings to be used in terms of skin tear, but rather provides the characteristics of dressings that will enhance wound healing. In addition, during the health economic session, there's evidence that suggests that soft silicone dressings enhance wound healing. Products not to be used in the management of skin tears, including wound closure strips, transparent films, or hydrocolloid dressings with strong adhesives or gauze. Thank you for your attention. The Made Easy is available at ISTAP's website, or you can scan the QR code. Thank you.